So obviously there's been an upsurge in demand. The government have encouraged it and created it. How much forward planning for this did you see in a GP's practice?
Well, I mean, we had no prior warning to it, of course, and I have the fortune of working both in hospital and in general practice. And what I've seen is that there is a huge shortage of these lateral flow tests, as everyone's mentioned, but that was sprung on us just a few days before Christmas, New Year's. Everything's coming up and everyone wants to be safe and we want to see our family and friends for the first time in a long time. And so many people can't get hold of one, and it's really put people out of kilt here.
Yeah, and I guess tomorrow night, I mean, it is New Year's Eve. We weren't allowed to celebrate last year, and I know there have been, for example, the fireworks have been cancelled by Mayor Khan in London, but I think people have got, fairly substantial plans tomorrow. I'm guessing a lot of people just won't be able, as you see it, to get a lateral flow test before attending a social event.
That's right. I mean, I was helping out at a pharmacy recently just because of a shortage, and 20 to 25 people came in with codes saying, look, I want to pick up a lateral flow test. There weren't any. You speak to the pharmacist, they said, we don't have any. We can't get any. We don't know when they're going to come. So many people are desperate for it. They want to do the right things. They want to protect their families. They want to look after their loved ones. They want to look after themselves. They don't want to spread it. But you look at it and it's so complex. I mean, look at it from that pharmacy perspective. You've got COVID positive potential patients coming in, asking, arguing, getting aggressive, saying, I want my lateral flow, I need to know. You've got NHS workers also affected. If you are in contact or have a positive test, you're off for 10 days. But if you are able to have a lateral flow on the 6th and 7th day and they're negative, you can come back to work. But if there's no tests available, how can you do that? And so we're looking at an even more depleted workforce.
And I guess also, for most people, as you say, that change from 10 days to 7 days has put yet more demand on the system, hasn't it?
Absolutely, yeah. And I mean, we welcome that, especially as someone who works in the NHS at such a busy time. We would really want that support. We want our healthcare workers to come back as soon as they can. And they're desperate to make an effort and help as passionate as they are to help during this crisis. But it's such a challenge. And without those lateral flow tests, it's a real struggle. Of course, we're still encouraging the normal things, trying to reduce your socialization, trying to make sure you're wearing your mask, get your booster vaccinations. But ultimately, if the government makes a mandate to get lateral flow tests and there aren't any, that's really short-sighted.